So one of the most common things that I see in my office is an ankle sprain, and they come in all varieties. By definition, a sprain is an injury to the ligaments, most commonly the lateral ankle ligaments, the ATFL and the CFL on the outside of the ankle. You can also have a medial ankle sprain as well, and obviously other aspects of the foot and ankle can be sprained. I think it's important for a proper evaluation of an ankle sprain, although many of them resolve, on their own with rest, ice elevation, and some functional rehabilitation. There is actually a significant portion of patients who do have persistent or lingering symptoms, and it's important that we get them in and get them treated. And in the rare case that something additional needs to be addressed or something that's acutely surgical, get them appropriately evaluated so that there's not a delay in their care. So I think I would, I'm happy to see patients, immediately after an ankle sprain to get them evaluated and basically make sure that we don't have anything that we need to worry about long term. If patients do get to the point where they have persistent symptoms and they've undergone extensive management, rest, ice elevation, Buddha mobilization, sometimes brace immobilization, some home exercises, and some physical therapy, and have persistent pain, and an MRI, demonstrating an injury to the ligaments, and they have symptoms of instability, many are good candidates to have their ligaments reconstructed and ankle operated on to basically reestablish that stability, and that's one of the more common procedures that we do. So when it comes to a surgical intervention for a lateral ankle sprain after you've undergone conservative management and the patient is having persistent symptoms of instability, when these two ligaments, the ATFL and the CFL, are injured, the surgery entails putting a camera inside the joint, cleaning out all the inflammation, and also addressing any other intra-articular pathology that may show up in the MRI or may not show up on the MRI, which can also help with their prognosis, and making an incision over the lateral ankle ligaments and reconstructing them with anchors to basically tighten up the ankle so it's no longer unstable. And the rehab after that, we've gotten much quicker with our rehabilitation, trying to get our patients back to sports a lot quicker than we used to, with a short period of non-weight bearing, and then obviously a significant amount of physical therapy afterwards.